my friends. We are 5 months post-op from loose skin surgery. I had the, I can't even remember what it was called. Fleur-de-lis pendectomy, hip to hip, up the middle. You know the drill. You've been here for a little bit. If you have, welcome back. We're going to reveal what it looks like 5 months later, and not much changes. You can still see the incision redness. The stitch abscess and any kind of pin-sized hole is all wrapped up. It's just red and kind of that healing look. But the swelling has gone down significantly, where you can start seeing a little bit of the midsection and the abdominals and stuff like that. So it's going to be a very quick, to the point video. 5 months later, I'll go into some tips and what I'm doing and go from there. So without further ado, here we are. See the incision. That is not the incision. That is my paint line that goes up. So I actually wear everything up here now, which down here was typically where I could only go because my stomach would come over. And so now, can't even see it. But for the purposes of this video, to show you the incisions, you can see how it's kind of still, oh, there you are. This is still either skin or swelling 5 months later. Still feels a little numb and sensitive to the touch. But this area here, you can see is coming along. A little bit darker area here because of the pin-sized hole. This is where the stitch abscess was. But you can see some areas are slowly becoming skin color. There. Now what's going to happen is for my second skin surgery, when I'm able to have it, she is going to lift and lift, and so a lot of this will become tightened, but the abdominal area is coming in a lot better. There's a lot more definition, which I appreciate. Kind of see the work that I've been trying to do. So in the correct lighting, you can see more. You see something? I think I see something. Anyways, that's where we're at. This is soon going to be gone. Up and then up. And then, I don't know, an additional surgery for the additional back. Is there something they can do with that? I'll find out afterwards. But if they lift this up, then that's going to remove quite a bit. She's going to go all the way back into here and bring it up. So that's where we are. 5 months in. If you go back to my first month, you can see quite a difference. But yeah, that's where we're at. As far as tips and tricks and recommendations, still wear your binder. Still wear your binder every night. Put arnica gel on it. I need to do that more. Use a lot more vitamin E oil, which you need to put on the skin. Hydrate it, put it in a good spot. High protein diet, focus on water, scar tape, which I've actually got a little, this one's from Amazon. These little scar tapes, I don't have them on now because I'm doing the video, but put these scar tapes on there and you're going to have them on for like 6 months because it's fantastic. It just helps it feel more secure. Now, as far as what I'm experiencing numbness wise, occasionally I'll just get a pinching numbness where I just have to like slap it or move it around. It just feels weird. But overall, it doesn't hurt. I'm used to it now. I'm running quite a bit. So I'm going to be running and training, or I'm training for a marathon. And so all the running and stuff like that hasn't really, I haven't encountered any problems. The problems that I was having 2.5 months in are completely gone now 5 months later. So if you're watching this and you're going through it and you just had surgery, give it time, just like everything else. 5 months in, you're going to feel better. So give it time. But that's where we're at. That's it. That's all. 5-minute video. We'll see you later.